Welcome back to my channel and thank you for tuning in. If this is your first time here, my name is Suzanne Talui and I'm a licensed clinical social worker and owner of Embrace Psychotherapy located in Norwalk, Connecticut. I like to share my professional opinions on mental health issues that may be impacting you, and today I want to talk to parents who are considering or looking for therapy for their child or adolescent. I am by no means an expert, but in my practice, I do work with children and have worked with a number of children of different ages. I can say the younger the child, the more challenging it can be to work with only the child without the parent's involvement. So I want to take some time out to highlight the importance of a parent's role in the child's treatment. I have outlined 6 tips that can be helpful in producing the best outcomes when having your child go to therapy. Number 1, you may need to be more involved than what you think. A lot of children and adolescents who come into therapy are experiencing issues at home with their parents. And this may not always be the case, but to parents who have issues with their children not following the rules, misbehaving at home and at school, not responding well to discipline techniques, being combative and abusive, please know that there's work to be done at home, at school, as well as the therapist's office. For children experiencing these issues, there is more of a collaborative approach that needs to happen, and it's important for everyone to be on the same page in helping the child adjust and modify their behavior. So this means communicating with their teachers, communicating with the therapist at the school, communicating with the therapist, having everyone be a part of this child's treatment is very important. Number 2, don't be too proud to take parenting advice. There are many times in my experience that it may be hard for a parent to hear that they need to change their parenting techniques, and they're not always open to it. I understand that as a parent, you know your child best, and you may feel that the suggestions that are being made won't work, and it's hard to hear that you're not making the best decisions. I would encourage you to put your ego and your feelings to the side and understand that being a parent is not an easy task. You do the best you can with the tools that you have and hope that your child comes out on the other end a functional adult. With that being said, be willing to put more trust in the guidance of the therapist and other professionals involved in your child's care. After all, you are trusting that they can help your child. You also don't have to completely give up on your parenting techniques. You can be flexible and utilize other techniques in addition to. It's just more tools in your toolbox. For all parents considering therapy for your child or adolescent, remember to be patient. Treating children is different than when treating an adult. Children most of the time are being told that they need help and are going to therapy because their parents want them there. It can be hard for them to start to open up and trust another adult whom they do not know. It can also be hard to use tools that they are given in therapy if the parent is not a part of their treatment and encouraging the same behaviors at home. Your child's progress will take time, and change is not a linear process. You may start to feel that therapy isn't working if you see your child fall back into old behaviors. There are going to be times your child may take 1 step forward, but 3 steps back. It's all a part of the process. This brings me to another point. Make sure that you are providing positive reinforcement and praise for small wins. Children need reassurance and validation because they are learning how to be people. They need to hear they are doing something right. If you only give attention and notice to negative behaviors, this will be discouraging to your child and may be a barrier to them getting better. Number 5, check in. It is important for you as a parent to check in with your child and their therapist periodically. If you can, have a one-on-one session with the therapist to learn what tools they are gaining in treatment and explore ways to reinforce these things at home. It is also validating to the child when the parent is actively involved in their treatment. It shows that you are invested in their well-being and doing the work as a parent to help them. And a final point I want to make to parents is to also consider seeking your own therapist, because being a parent can be stressful, and while your child is going through their own therapeutic process, you may need some extra guidance and support to deal with the new challenges. Going to therapy does not mean you're a bad parent or not doing a good job. It just means that you're invested in your child's development and well-being, and you're open to seeing things from a different point of view. I hope these tips were helpful and will guide you in producing the best possible outcome for your child. Thank you for taking the time out to watch my video, and if you're interested in more mental health insights, please visit my blog at www.embracepsychotherapyllc.com. And if you would like to see more content in the future, please like and subscribe. Bye for now.